Ireland has the fourth highest suicide rate in young people across Europe. In Ireland, Limerick has one of the highest regional suicide rates. Given the impact of COVID-19 on all parts of society, mental health difficulties in young people are expected to become even more of an issue. Schools are an ideal setting to promote mental health and prevent distress and suicide in young people. However, it is important that young people have a voice in school mental health and suicide prevention. Young people's involvement in school mental health aligns with Article 12 of the United Nations Convention on the Rights of the Child, which outlines that young people have rights to express views on matters impacting them.
The Mental Health of Youth Story Study is a partnership between Dr. Jennifer McMahon and Evelyn Walsh of the Department of Psychology and Skylab, and John Rail and young people of Be Well Limerick Youth Service. The aims of MYSTORY is to understand young people's perspectives on youth and school mental health, involve young people in research and empower them to voice their perspectives on school mental health and suicide prevention, in both research and the community. Today we are going to voice what schools could do to enhance school mental health and suicide prevention by sharing 3 asks of young people, based on experiences of young people told in a series of narratives. Photos included in this piece are photos that were exhibited in the MYSTORY Photo Voice exhibition, which featured as part of Limerick Mental Health Week 2021.
We're going to begin with Alex's story. After doing schoolwork during COVID-19, coming back to in-person school can be a difficult time due to worries about schoolwork or meeting friends face-to-face. These feelings can lead to stress or anxiety in the school life. This happened to Alex. Even though Alex had personal issues at home, issues with friends soon became a problem in school, and they got really overwhelmed with stress and anxiety. They got so overwhelmed that one day, during a class assignment, they found they couldn't write anything no matter what or how many times they tried. Alex had a panic attack in their classroom in front of everyone they knew, their peers, and their teacher. They felt it was so embarrassing for them to even have a panic attack simply because about the amount of attention that they got was so unnecessary and was incredibly overwhelming. Their issue became a classroom issue simply because they had a panic attack in school. Students spend so much time in school that their mental health difficulties spill over into their school life. However, sometimes teachers can be very helpful with calming down a student in a high-stress situation. Alex's teacher brought them out to a separate classroom to give them space and time to talk to their teacher. They could feel that they got support from their teacher. However, oftentimes, most young people feel as though they don't get the help they need from teachers, which can be very disappointing. Alex simply wanted a place to vent and share their feelings with their teacher. However, these feelings can be very difficult to communicate as a young person.
This next narrative belongs to Morgan. Trying to help someone who you can't help can be very challenging, especially for a young person. This was true for Morgan, whose friend Sam was experiencing distress due to relationship issues with their parent. When Morgan tried to offer advice to Sam, they felt like their time was being wasted, and they felt disappointed because Sam wasn't taking their advice. Eventually, Morgan started to worry for Sam's mental health. Morgan didn't want to assume the worst, but they felt like Sam's security was in jeopardy. It is sometimes hard to say, "If you need help, I'm here." Eventually, Morgan's mental health started to be impacted by this.
The final narrative that we're going to share is Cameron's story. Anybody experiencing suicidal thoughts or disordered eating knows that these can be extremely challenging and isolating times, and this can be much worsened when it comes to being in a school environment. Cameron wanted to seek help, but felt that they couldn't turn to their closest friends or their peers because they didn't want to add to the already extreme workload that they were facing in school. They didn't want to feel like they were a burden to the people that they loved most. Because of this, it was much more appealing to want to turn to a trusted adult, such as a teacher or a guidance counsellor within the school. However, Cameron had the perception that these teachers were already so busy with their own classes, or that guidance counsellors may already have prioritised careers advice or third level education advice for people leaving the school, that they didn't want to again add to the pile or become a burden to them. This perception can be dangerous, and because of this, many people are encouraged to seek help outside of school from professionals. Schools also may not be able to facilitate such issues, but not all young people want to seek professional help. Sometimes they just want to confide in the people that they trust the most, but this isn't always possible.
Based on these narratives, we are giving 3 asks from young people to better promote mental health and suicide in school prevention. Ask 1. Involve young people in mental health and suicide in school prevention. Young people would love to be involved in identifying their school mental health and building tools and spaces for further support. One way to better involve young people is by co-creating protocols and resources by school staff and young people and mental health workers. These resources would be deemed as valuable by staff members and further introduce autonomy to young people for their school mental health. These protocols would need to be updated frequently to keep up with ever-changing times and needs. Also, ask boxes and email addresses could be provided to young people for further concerns on their needs for mental health and suicide in school prevention. Projects that actively involve young people could be useful for them in participating in mental health and suicide in school prevention. Projects like MYSTORY, which empowered young people to share their personal and school mental health perspectives through photography and discussion. Schools could use creativity combined with mental health to further achieve their goals, as creative outlets for expressing oneself could be easier in managing challenging mental health topics.
Ask 2. Provide young people and parents with the tools to help young people. Sometimes young people need help with working on themselves, i.e. improving communication and coping skills. Schools have the potential to provide spaces and resources to parents in order to help their child. Schools could provide assistance to parents with dealing with their own child and with facing relationship issues. Schools could also provide assistance to young people with assisting a friend who may be dealing with mental health issues. This could provide young people with a way of talking about mental health with those around them. No school is one and the same, and every school has different needs. This is an example of where singing from the same hymn sheet doesn't work. Young people should have the ability to talk about mental health with their school and with the different teachers that may be able to help. With this facilitation of different courses and workshops in schools, young people will have a better understanding of mental health in schools.
Our third ask is that when supporting young people in their mental health, just listen to young people. Young people can often feel that adults think that we don't know what we're talking about. And because of that power imbalance, it can often be difficult for us to speak up about our needs and our wants when it comes to mental health facilities and resources. Because of this power imbalance, and because young people do not speak up, adults can often make decisions on our behalf rather than with us, meaning that we don't get the help that we truly need and are seeking. When young people are part of the conversation, we can be part of the solution. And it is essential that young people are kept in the loop about the decisions that would be impacting our lives and the services that are made available to us.